Hello everyone, my name is Vadim Koshkin. I'm here with GU Oncology Now, and today with me I have a very special guest, Dr. Loriot, to discuss the THOR study. Dr. Loriot, maybe we'll just start by you giving a quick overview of the design of the THOR study and the motivation behind the study.
Yeah, the motivation was based on data from a phase 2 trial that we reported 4 years ago called BLC-2001 study. Actually, we found that 15-20% of the patients with metastatic urothelial carcinoma FGFR alterations, FGFR2 or 3, and we use a pan-FGFR tyrosine kinase inhibitor called erdafitinib, and we show in this study that the objective response rate was 40%, median PFS 5.5 months, and median overall survival more than 1 year. So we need to confirm this preliminary data, and so we develop a phase 3 trial, so a confirmatory phase 3 trial called THOR, where we compare actually erdafitinib to a standard of care. So here, the chemotherapy in this cohort 1.
And these, what's presented at this conference are the results of just one of the cohorts of this study.
Yes, indeed, cohort 1, yeah.
And can you say more about that, what the different cohorts were and what data is being presented?
So basically, the cohort 1 compare erdafitinib to chemotherapy, while in the cohort 2 we compare erdafitinib to pembrolizumab in the checkpoint inhibitor naive populations. So in the cohort 1, the patient had metastatic urothelial carcinoma and of course FGFR2 or 3 gene alterations, and they were previously treated with 1 or 2 lines of therapy, that including an immune checkpoint inhibitors.
So all patients in this cohort had an immune checkpoint inhibitor?
Indeed, yeah. Right. So the patients were randomized 1-to-1 to receive either erdafitinib, an oral drug, or the chemotherapy. So it could be docetaxel or venflunine. And we have selected overall survival as a primary endpoint, and the key secondary endpoint include PFS, response, and safety.
Absolutely. Yeah, and this is data that we've been eagerly awaiting for some time. Tell us what you found.
So we had an interim analysis. So what I'm reporting here, the result of the interim analysis. And what we show actually that the overall survival is longer in the group of erdafitinib compared to chemotherapy. The median overall survival was 12.1 months in the erdafitinib group versus 7.8 months in the chemotherapy group. So the hazard ratio was 0.64. So we reduced the risk of death by 36%, and the difference, of course, is significant. So we look at the PFS overall response rate. So erdafitinib increased the PFS 5.6 months versus 2.7 months in the chemotherapy group, and the objective response rate was 45% in the erdafitinib group versus only 11% in the chemotherapy group, and of course it is significant. So basically all the efficacy parameter support the use of erdafitinib.
Yeah, and it sounds like the results are pretty consistent with what we saw in the phase 2 study. Just this is now a randomized trial that really lends further support to the use of erdafitinib.
Exactly. I think there is 2 consequences. I think the first one is that we added probably a new option care in patients with metastatic urothelial carcinoma with FGFR2 or 3 alterations. And the number 2 is that we should require a molecular testing for all patients with metastatic urothelial carcinoma so that we can identify quite early the patient with FGFR2 or 3 alterations.
Yeah, absolutely. And really the biomarker selection here is key. Can you comment more on what strategy this study used? How did you select and find these patients?
So not all FGFR2 or 3 alterations are oncogenic. So that's why we selected just a couple of FGFR2 or 3 alterations based on preclinical studies and what we did in the BLC-2001 study. So basically there are some fusion 7 and some mutations, the most frequent oncogenic mutations. So we can do a DNA molecular profiling based on central lab, but we allowed also to do a local testing. But in any case, we have to confirm this data by a central lab. So basically what we need for the patient now, DNA sequencing so that we can identify this patient.
Yeah. And finally, can you comment a little bit on the toxicity of erdafitinib and chemotherapy, respectively?
So the safety profile observed in the study were very consistent with what has been reported in the past. So hyperphosphatemia, stomatitis, and NDR were the most frequent treatment-related adverse events. And very few patients discontinued erdafitinib due to treatment-related adverse events, 8%. In the chemotherapy group, 13% of the patients discontinued chemotherapy due to treatment-related adverse events. And in terms of serious adverse events, 13% in the erdafitinib group versus 24% in the chemotherapy group. Of course, we look at the some adverse event of interest, eye disorder, night disorder, and for the central retinopathy, 17% of the patients had all grade, and 2.2% of patients with grade 3 or 4. So basically, we confirm what we observed in the phase 1 and the phase 2 trial.
Yeah, so it sounds like overall across the board with toxicity and efficacy, data is pretty consistent for erdafitinib now in this randomized trial. Congratulations again.
Thank you.
This is wonderful data, and congratulations on your presentation at the conference.
Thank you, Vadim.